Sitting on a toilet for too long can cause hemorrhoids. You could die.
In fact, sitting down causes a lot of problems.
What is considered a long period of time?
I think probably anything more than half an hour at one go.
Whoa! You can't sit, you can't stay.
Yeah, so you lie down all the time. Right, isn't it? Can you actually help me right?
In our lifetime, we have a 20-25% risk of developing some vein problems over time. Just because you don't see these big dilated veins on the surface of them doesn't mean you don't have vein problems.
So this episode is brought to you by Severe, and they wanted us to raise awareness about vein problems, which we didn't at first think that there was anything to talk about. And then when we did a deep dive, we realized actually
It's quite interesting.
Very interesting. And so today we invited a vascular and endovascular specialist. Please welcome Dr. Tang. Welcome to the show.
Thank you very much.
Did I get that right? Open vascular surgery?
No, you didn't, but it's, I prefer endovascular surgery. It's all keyhole now, actually, vascular surgery. But
What's the difference?
Okay, let me tell you. Endo means from within, which so basically you work within the vessel. It's almost like space, basically. You got a little thing that runs inside the artery. Whereas open surgery is you cut the person open and you're looking down at it, basically. So if I want to do an open surgery, I cut the skin and go all down and find the blood vessel. Whereas with keyhole surgery, where you work within the vessel, that's endovascular. And that's where this specialty is going.
So how do you see what you're doing?
So everything's done with ultrasound or with X-ray, you know?
Okay.
So that's why my hair is going white and I've got no hairs because I've been using so much radiation over the last 10, 15 years. Vascular means about the blood vessels. I'm a plumber, a glorified plumber, okay? I touch all the blood vessels, which I mean the arteries and the veins. So arteries and veins are not the same, okay? Arteries take blood from the heart to the foot. And so in the circulation, it has to come back up. So it comes back up in the veins.
Right.
And the veins have two systems. Keep it very simple. There's a big, deep vein down the center of the leg that takes about 90% of blood back up to the heart. That's the one that's responsible for aeroplane flight problems like deep vein thrombosis and clots. Whereas the veins on the surface are when they cause problems like varicose veins or dilated veins on the surface, which can be very cosmetically a problem for, especially among females, but also can cause skin problems and medical health issues, which we'll discuss later.
Okay.
But I don't touch the brain and I don't touch the heart. Those are two black boxes that I don't touch. So cardiologists touch the heart only, and neurosurgeons like my wife is a neurovascular surgeon, touches the brain, but I can't touch anything. And there are some areas where they combined. So there's an artery in the neck called the carotid artery. That's how I met my wife, by the way, over operating. Okay, so we used to operate on the carotid artery together to prevent stroke. So normally you have to say yes and you just defer. So some of the cases, how I did with her, basically you learn to keep quiet like you normally do.
The secret to a successful marriage.
Yeah, I'm confused. Do you invite the patient to the wedding?
Actually, we do tell the patients if my husband or my wife is going to come in, because we used to do it together. Especially at Singapore General, she used to invite me to help her with the cases because in Singapore, it's a kind of carotid surgery to prevent stroke. It's a very politically charged area. It can be very combative, very competitive. So actually it's done normally by neurosurgery. But vascular surgery in the UK and in Europe and in the US is done by vascular surgery. So it's different specialty turf. But if you combine your skills, you know, I think it's only best for the patients.
Get the best of both worlds. Wait, so I do want to dive into meeting your wife. So how did that happen?
Yeah. So I met my wife over the operating table, right back in Cambridge. We were research registrars at the similar time. So we did a common case, the carotid, so the carotid artery. And therefore you have to go in and take out that blockage or unblock it.
Okay.
Let's scoop out all the crud from the artery, stitch it back up again and make the blood flow again. So that's how we met. So I asked her for a coffee. And then she scared the hell out of my boss, by the way. She scared the hell out of my boss. So she said, she's quite a scary lady, my old boss. I said, yeah. So anyway, so our bosses didn't get on very well. So we just left us to do the operation together. So that's how I met her. Yeah.
So cute.
I don't normally say that, but please. That's okay.
So I'm guessing that was a very successful coffee session.
So yes, but now you turn it down 15 years later. My nieces used to say, how come you're so quiet, Tjun? I said, you just learn to keep quiet. Just do it the way she wants to do it. All right.
Okay, so there are a string of blood questions that I have for the doctor, and I prepared them because I made a mistake. I thought he's a blood doctor, but he's not. But he has been kind enough to say he will try to answer anyway. Yeah. So we're going to ask a few of those questions first.
I think most of us know that there are different types of blood types and blood groups.
A, B, B.
AABB, this is not like Standard & Poor's rating of the stock market.
A minus, A plus, B plus and minus also?
Dr. Tang is going to come in and school us.
We're just winging this.
Okay, basically it's all based on the ABO system, okay?
Yeah.
There's only 3 letters, okay? So you can have a mixture of these, all right?
Okay.
So, and the minus and the plus is basically something to do with rhesus, basically. It's about the compatibility with baby and mother, basically. That's what it is.
And it's RHESUS, not the
peanut butter cups. Okay, got it.
I knew you were saying that. So the most common blood group is O. Okay, O positive. In Singapore, it makes up probably about over 45% of the population, so it's very common. O negative is the universal donor. So basically, anyone who has O negative blood is a very important person, and that's what a lot of these blood donor drives are looking for, and they are very special people.
Right.
O positive is probably the most prevalent type in Singapore. In the world, it's about 39 to 42%. So actually in Singapore, O positive is actually higher than the normal population in the world. The universal recipient, okay, the one that people can receive blood, is AB. But it's one of the rarest blood groups. It only makes about 4 to 7% of the population.
Yeah, my mom is
Right.
Fantastic. So she can receive anything, but cannot donate.
Yeah, so it's the complete opposite
So
from O negative.
That's right,
You are the
that's
universal receiver.
Do you know what your blood type is?
I'm not sure because for the longest time my parents told me that I was B, and then when I recently did a health screening, the ABO group was A. But I've done the math, I've done the whole table, and I saw that between my dad and my mom's blood types, I could either be A or B. So
it's
I
A
will
lah.
go and do.
Or are you AB?
Oh, maybe. But I don't know how accurate these blood tests are. It should be quite accurate.
It is very accurate, and you should really know it. And most people should. If you're in an emergency, especially overseas, you should really know your blood type.
Okay.
Otherwise, it takes time for him to cross-match. Do you know your blood type?
Yeah.
What's
I'm
that?
O, but I don't know whether it's plus or minus.
You're probably going to be plus.
Why?
The
Just from
rhesus.
probability.
Probably from probability. Yeah. So, but
So I read that like with different blood groups, essentially it was natural selection. So these like the groups that we have today were the fittest that survived because different blood types can combat different diseases. For example, like with malaria, apparently type B and O are okay. Like the disease doesn't stick onto the blood the red blood cells for B and O, but it does for A. Like it could create like blood clumps.
You're absolutely right. Now, before we start discussing this,
Yeah.
there is no scientific evidence for this. Okay?
I see.
I'm going to be frankly honest with you. There's no science. But yes, there's an association with people who are O, basically have less effect with malaria than
Yes.
someone with but then someone
Association.
but then someone who is A potentially have a higher risk of developing certain cancers like stomach cancer. B,
No.
there's an association with higher pancreatic cancer risk.
Oh no,
All right?
JP.
I don't know why it's fine.
So it's good to know actually, in some respect. Yeah? And then some patients like with O, have less risk of developing severity, like from COVID, there's been some research into that. But still,
Wow.
there's only associations. There's no real proven
see.
records. It's very important to show what is association and what is was a true risk factor.
Clinical.
So
Yeah.
like correlation versus causation.
Yeah.
That's right, exactly.
Okay.
So you got to be a bit mindful.
We did want to touch on a little bit of on some myths or potential truths because we came across this and it was just so ridiculous that we thought it was worthwhile talking. The first was sitting on a toilet for too long can cause hemorrhoids that can bleed so badly you could die.
I've heard of that.
Really?
Yeah. Like taxi drivers also will get hemorrhoids, right? Because they sit for so long.
No, but not until you die lah.
Wait, didn't Elvis? No. Sorry, I think Elvis one was a heart problem. From Elvis one. Let me look this up. I'm very interested by Elvis.
Well, someone dying from bleeding from piles, I think is extremely rare. I've never encountered a patient with that, but potentially, yes, anything can happen.
True.
Normally, it's because you're sitting down there a long time, you're straining on the toilet. So these piles, which are engorged anal cushions, that's the term for it. And that's what they are. That's the definition of it. That is the definition. They're engorged anal cushions. They are not varicose veins, by the way.
Okay.
Everyone mistakes this. But basically, you strain, and basically they bleed because they become very friable. They're under high pressure. And they burst.
Friable?
Yeah,
What's
friable
friable?
means that they become very thin. Those cushions become very, very thin in your back passage.
Right.
And then that's how you bleed.
I love this.
And you can,
terms
and
are your back passage.
You can bleed very profusely. So yes, if you can't stop the bleeding, right? Yes, sure, you can bleed. You could bleed to death. But I've never heard of it though.
As in
Someone has,
the cushions bleed?
So the cushions in your back passage do bleed, yeah. In fact, sitting down is actually an evolutionary kind of mishap, really, because it actually causes a lot of problems.
So we're not
sitting down.
meant to sit down
For long periods of time, no.
What is considered a long period of time?
I think probably anything more than half an hour at one go.
Whoa!
So yeah, I never sit down for half an hour if I can help it. If it's a long consultation, I'll probably get up actually after sooner or later. But it's very difficult in front of your boss, isn't it? You know, you're at a table, at a meeting, you know.
On a podcast?
Podcast, yeah. Can I get up in a minute? It's like, you know, it's not customary thing to do. And type A, very strained, you know, don't drink enough water. That's probably the biggest number one enemy of piles in this country, because you dry up, because it's in temperate climate, you're very dehydrated.
Right.
It's a big problem. And then your stool is very hard. It cuts into the bowel at the back of your passage, and it causes can bleed.
Right.
Yeah. Your hard stool, not good.
Okay.
Wow.
I'm not a colorectal surgeon, by the way, but I did general surgery when I was training. So I am a general surgeon by training, but I have removed piles. But this is the kind of the thought process of why piles bleed.
Okay.
That's interesting.
That's one of the reasons why I didn't do colorectal surgery, because of the poo handling. Okay, that's what we had to do. All right?
Just to close the loop on the Elvis thing. So I looked it up, and apparently, no. So he died from a heart attack, but it was
did.
because of the strain of attempting to defecate, which compressed the singer's abdominal aorta.
Okay, so that doesn't really make sense. If you've been straining on the toilet, one of the things that you can die from actually is clot on the lung. So basically, if you're straining and straining and straining, you increase your intra-abdominal pressure, okay? And any kind of clot can go from there. If you build up a clot, it can shoot to the lung and cause a pulmonary embolism. That's probably more like it.
In a very layman way of explaining, what's a pulmonary?
So this is the thing that you get on the aeroplane. So people develop clots in their legs. So these are blood clots in the leg.
Yep.
And then in higher atmospheric pressure, they can fly to the lung and basically block the right side of your heart and cause cardiopulmonary collapse, basically.
Heart attack.
So something like heart attack, but it causes your whole blood system to collapse, and that's what we call a pulmonary embolism. Is a clot on the lung normally coming from the legs.
Wow.
And it can cause a heart attack. So you can die from it. So the end result is a heart attack. Yes. You're sitting on the toilet for long periods is a very bad thing.
It's a bad idea.
Yeah.
So no more
Limit
than half
your
an
time.
hour.
Well, I would limit yourself, but keep your bowels. The bottom line is keep your stool soft and then make it easy. Okay. Have more water, fiber, vegetables, fruit.
You've heard it here first from a
Basics, you know. In our lifetime, we have a 20-25% risk of developing some vein problems over time.
So 1 in 4.
1 in 4.
Somebody.
And the prevalence, these are the figures, every decade that goes by, there's an increase in 10% prevalence of vein problems. So by the age of 70, there's a 70% prevalence within that age group of vein problems. So it's actually a very underdiagnosed, underappreciated problem. I mean, we're all thinking about cancer, we're all thinking about heart problems. Well, this is actually a very much easier thing to deal with, but actually it's not as well recognized.
Okay, so let's dive into this a little bit. Like, are there certain activities or like diets or food? Like, what are we doing that's actually contributing to like vein problems?
So as we age, we're living longer. In our population, unfortunately, in the Singaporean population, we've got very high diabetic rates. And diabetes is a chronic disease, and sugars, that's right. So obesity becomes a problem. So people who don't do much exercise, adding weight centrally puts a lot of pressure on the legs because it's compressing the outflow of blood, and therefore blood becomes very static. So obesity is associated with vein problems. So people who are like couch potatoes, don't do much exercise. Again, the blood is very static in the legs. Actually doing exercise, running, you know, Pilates, stretching. As we age, we're becoming much more inflexible, you know. So our blood, and so we don't move our legs very well. We don't move our joints very well. Therefore, we can't engage the muscles in our thighs and in our calves. And inside those calf muscles, there's high amount of veins. Okay, there's a lot of veins. So when you contract the muscle, the veins get squashed and the blood goes back up to your heart, okay, literally.
Yeah.
So you're not using your muscle pumps very well.
Right.
Wouldn't it like an easy way out would just be to sleep with your legs propped up?
Well, I mean, it's easier said than done, actually, because you try it tonight. Because today, you put your legs up, yeah, they feel very comfortable, but a lot of people cannot sleep lying flat on their back, okay? A lot of people like to sleep on their side, okay? So it's very difficult. So technically, yes, that will definitely solve a lot of vein problems, but but if you stop lying flat with your legs up, the effect almost goes immediately. Another group that's a big problem, you know, not just obesity, people who smoke. Smoking is very bad for the valves and the veins, basically. Yeah. So, and it damages the valves. The valves, what I mean by valves, these are little flaps basically inside the veins. It's like traffic lights, pushing the blood from the foot back up to the heart. Remember the veins the blood flow is under very low pressure. So therefore, if gravity not being your friend will pull the blood down. So these valves act against it to keep the blood going back in the
It's like
correct
pinball.
direction.
Right.
Absolutely right. And so over
And it's
time,
one way,
It's
right?
one-way
Yeah, one
valve.
way.
So ultimately over time, and these are all the way up the veins, right? And the blood just pulls down the wrong way. And that's called venous. It's called venous reflux. A big two terms basically saying the blood is going the wrong way. Just because you don't see these big dilated veins on the surface of the vein doesn't mean you don't have vein problems.
Okay,
and it's a
okay.
real thing, misunderstanding, especially also in the medical community who are not specialists in that area, don't realize that.
see.
So you see a lot of people with those darkening of their skin. You think it's a suntan or you think it's diabetes. Well, actually it's not. It's something called chronic venous insufficiency where you've got a vein problem, underlying vein problem. And sometimes when I'm actually quite frustrated outside, my wife tells me, stop looking at these people's legs, right? And it's just like, I want to tell them, you got CVI. You got CVI. Go and see that, right?
Do you tell them?
No, I tell. Obviously, it's not socially kind of graceful, just something like that.
But you're saving their life.
There's so much explanation.
So you do not need to have these dilated veins, like varicose veins, these dilated veins on the surface to have a vein problem. There's this hidden vein on the inside of your leg and in the back of your calf, which is faulty, but actually you don't actually see it. And all you're seeing with varicose vein are the branches off these faulty veins. That's all. But if you don't see it, it doesn't mean you don't have a problem.
Okay, so if I'm a viewer now and I'm watching this part of the video and I'm like, oh shit, maybe I have a problem,
I need
right?
to check my legs out.
Can I immediately look at myself and identify if I might have a...
That's a great question. Great question. So things to look out for. Are your legs feeling heavy towards the end of the day? Do they feel tired? They feel like lead pipes. Worse in the evening than in the beginning of the day? Are there swelling around the ankles, especially when you go up in the airplane? You know, when you go up in the airplane, you're sitting in economy class for long periods of time. Do your ankles swell? Well, they swell more than normal. It's a sign that there may be vein issues here. The other thing is at nighttime, you may get muscle cramps that are keeping you awake at night. Other things is like itchiness in the skin. Your skin's becoming a bit browner in color. You're not sure why. You don't do too much suntan, sunbathing. Then you got to think to yourself, is there some problem in my leg? And there's also, it does run in the family. 20-30% of these patients have some sort of family history, particularly on the maternal side. So there is a genetic component. It's not a genetic disease, it's a genetic predisposition.
So a term that you've been using quite a bit is varicose veins, and I'm guessing this is one of the problems that are quite pertinent when it comes to like vein problems. What are they exactly?
So varicose veins, the definition, if you can say this, you'll be better than some of the medical students out there. Because when you ask them,
Can't
they
memorize.
can't even give you a definition, right?
Okay.
Okay, so abnormal dilatation
Okay.
of veins in the lower leg, in the limbs,
Okay. Lower limbs.
more than or equal to 3 millimeters in size.
Okay. Understood.
Millimeters.
And
Okay, got
that's
it.
what it is. That's
Yeah.
what it is.
How do you differentiate that between it's leg day, I'm just working on
I'm
my
just
legs
tired.
and it's dilating?
Hard to know. But your leg day, you're doing it in the gym, you're going to get tired for sure.
Yeah.
But if you're it's something that you will notice over time. That, you feel that the legs feel very heavy. They don't feel as if they belong to you, especially at the end of the day. You've been standing up for long periods. Job-wise, there's a predisposition for people in the F&B industry standing up for long periods. It's not just sitting down.
Okay.
People who've got desk jobs, same. It's the same predisposition. Having architects, that's why I have those lovely tables, right, to sit down properly on.
ergo
Almost
tables.
stand.
So you can't sit, you can't stand.
Yeah, so you lie down all the time.
Great, isn't it? It's
Can you actually help me write?
Doctor's order.
Show my boss, yeah.
Actually, I had a patient ask me for a letter to say that can he actually lie down actually doing his work actually with his legs up.
Did you write that letter?
I didn't. I don't think the Ministry of Health will be very happy with me.
So what is recommended for the maximum duration that you should be standing?
Okay, standing still is the worst thing. Walking around. Standing still is the same thing as sitting down. Your legs are gravitating. So the blood is gravitating when you're sitting still or standing up.
Anything static?
Anything static. One of the best exercises is actually squats. Actually, squats are very good actually.
Right.
So, especially in the gym. So as you get older, I know myself, one of my things my personal trainer says, just you do squats, actually very good exercise because actually engages your core, engages your calves, engages your thigh, muscles, and you're pushing the blood out of your leg. So very good.
So you mentioned about like vein problems by like feeling and feeling a bit tired and things like that. But what are some cosmetic signs of it?
So another group of patients that come and see me now in private is young ladies, just like yourself.
Really?
Call her young.
It's actually rude. How young are you? I don't
30s.
You're young. You're very young. Okay. All right. So what they see is, okay, it's a very rude thing to ask anyway, but is that you get a lot of these things called spider veins and thread veins. These are dilated veins on the surface of the leg. They're not as big as the 3 millimeter big varicosities that we see, but these are the smaller, the bluish, reddish veins that are broken veins on the surface of the skin. So, but it's also a sign of high venous pressure. Just like you have high blood pressure as you get older and you're taking medication to control that. That's from the heart issue and from the artery side. The same. In the venous side, that's a sign that there are these broken vessels on the surface. It means that the blood is not getting out of your leg properly. It's a sign that it may be a vein problem. What you need to get is a friendly vascular surgeon or basically to do an ultrasound scan of your veins to see if there's any what we call reflux in the vein, meaning that the blood is going the wrong way. If that's the case, we treat that and some of these veins will disappear. But also, it's also a cosmetic issue. The cosmetic issue is that you can zap these veins with the lasers. And in our clinic, we decided to buy these up-to-date lasers that you can get on Orchard Road that they cost you like $3,000 a go, right, on these beauticians, right? But we bought them for a specific reason, to give a full solution to a patient's journey for varicose veins, okay? So no, you just treat the medical veins with Keyhole, okay, we'll come to that in a minute, but then you can treat the cosmetic element, the little tiny veins, and you can zap them. You don't need needles anymore. The old way was the gold standard way previously was to inject them with this special chemical called sclerosant to block them up, but obviously needles are however. These are just little little ant bites literally with lasers, and you can do it in the outpatient setting.
Is it similar to like tattoo removal?
I can do that with my laser if you wanted to.
For real?
Yeah. You want me to remove your $2,000 tattoo? Yes. So these are very similar lasers, and that is one of the functions that happen.
I see.
Yeah. Okay, so like for these, when it's aesthetics, there's no medical risk to it. So it's just for aesthetic reasons.
That's
Okay.
Are there any activities or lifestyle changes that you would immediately recommend, and does that is that able to actually reverse some of these?
Very good question. So walking, but running, definitely get the blood running is very good, but you don't want to overdo it as well. All right, and overdoing it. I was just talking to some people about this earlier. For some reason, since I went out into private practice, I've got about 10 spinners under my name who have developed vein problems or vein problems. Okay. Now, something about spinning, I'm not trying to be negative about spinning. It's great cardiovascular.
No, like the stationary cycling.
High intensity.
Not DJing. Okay.
No.
I thought it's spinning. I was like, who the hell does that?
Hits basically. Somehow it actually makes it worse actually, and it can cause vein problems. So moderate amount of exercise actually very good. The good exercises for veins include swimming because of the higher hydrostatic pressure on the legs. It pushes the blood out of the legs, right? It's very good. Swimming, even walking in the pool, cycling, yoga, not hot yoga, okay? Yoga and Pilates are thought to really help flexibility and
basically I do hot yoga.
I do hot.
What is the difference between yoga and hot yoga?
Oh, you're in a very, very warm room.
So you do yoga in a hot room?
You actually have like heat lamps and stuff above you. Right. And the
like
whole room.
It's like a sauna.
Yeah, exactly. So you sweat a lot.
It's very uncomfortable. I've tried it.
Yeah, it can be a bit uncomfortable.
So not good for vasodilate. Vasodilate your veins and everything. Not great, basically.
Okay.
So making your veins bigger is not good.
Probably not when you've got vein problems.
Because you want it to push.
That's right. Exactly.
Dang.
All right, so we've spoken a little bit about the varicose veins as well as like some venous diseases. What are the treatments available?
So whenever you start treatment, you try and be as less invasive as possible and don't go straight to surgery. Okay, so the treatments for vein problems, really medically wise, use compression stockings. So the highest pressure at the foot, least pressure at the thigh to push the blood out of the leg. And normally you can wear it for 24 hours a day. I have patients wearing it 24 hours a day. And basically it helps them and symptomatically improves their swelling, their heaviness, their cramps.
So it's a sock that goes all the way up to your thigh.
Potentially can go all the way up to groin actually, a pantyhose. Literally, yeah. So women tend to want to wear that, not men. Okay, mate. That's the thing. Yeah, so normally much more compliant patients normally wear it to the knee level. And on the aeroplane, there are a lot of patients wearing these compression stockings to prevent deep vein thrombosis. Okay, but generally, the compliance to these stockings are quite low in the Asia because of the heat, the temperate climate in this country. I would say the compliance rate is 20-30%.
The idea is compression makes the veins more compressed, and so it
pushes the blood at a greater pressure from the foot back out to the heart.
Understood.
So the other form is tablets, and we use things like micronized flavonoids, basically, and I use Daflon. Flavonoids are natural compounds, actually, are based from phenols, actually, found in vegetables, fruits, flowers, and these are naturally produced compounds found to have medicinal or beneficial effects in the body. Basically improves the contractility in the veins and the tone of the vein wall to push the blood out of the leg. Okay? And that also relieves symptoms such as heaviness, cramps, and to a lesser degree, swelling. And you can actually take it on a longer term basis without any problems.
Okay.
And we don't just use it for vein problems, we can use it for other problems such as we discussed earlier, the piles problem. Hemorrhoids.
Okay.
So we improve the itchiness, the heaviness in down there, and it actually reduces the bleeding. Again, it reduces, it improves the tone in the anal cushions to prevent, basically cause it to squeeze and contract down and reduce the risk of bleeding. And it's actually it's good, but you have to have it at a higher dose.
Deflates your cushions.
Deflates your cushions, yeah.
Okay. After treatment or surgery, for example, do they have to maintain or have to change their lifestyle, or does it permanently go away? Or will it come back?
You're asking really good questions, and this is what the patients normally ask me, actually. So obviously, yeah. But no, I mean, once you treat them with the new Keyhole methods, which mean the minimally invasive methods, the recurrence rates are much less than they were when we did open surgery, when we used to strip out the vein. Because stripping out the vein actually causes a stimulus to grow new veins. So the risk of having that problem when you're doing open surgery 20 years ago, the recurrence rates are 15-20% of some degree, not to the same extent, 15-20% at 5 years, right? Whereas now with the newer methods where we block off the veins with Keyhole, where we're gluing the vein, we're doing laser, radio frequency, and I microwave veins now, okay, to block them off. Not sticking it in a microwave, but I'll show you in a minute with the catheters and everything. We're putting the catheters inside the vein and we're heating the vein. You cause less trauma, less recurrence. So the recurrence rates normally at 5 years is less than 5% in good hands. But if you don't change your lifestyle and you're going to keep sitting down like this or standing out there, yes, you're going to grow new vein because you're going to be gravity. You're going to grow more vein problems. So you've got to have a change in lifestyle. You're absolutely right. You've got to change your lifestyle afterwards. Change your diet. Stop smoking. Okay, smoking is very bad. Yeah, so smoking, that's okay.
He doesn't.
Stop smoking. Change your diet and get a bit of exercise in your diet. So this is an example of what we do with Keyhole surgery. It's just one device, a couple of devices that we use. Everything goes via a wire through that 2-3 millimeters cut in the vein, basically a puncture into the vein using a needle. We use a needle to go into the vein. It's painless because you're under a bit of local anesthetic or sedation. So you're sedated. You're not going to move. And basically what happens is that you are putting a wire up the leg, into the groin. And what you do is you inject glue. And basically, this is just very expensive medical adhesive glue. And you glue the vein. This is one aspect. And basically, you're just gluing all the way back. And basically, it's a pullback out of the vein. And this will collapse as you go. So if this is the faulty vein, this will all collapse and you seal it. And all you're left is with a hole like that, 2-3 millimeters, at where you punctured site is. All right. Another way of doing it is that we can use, this is an example of a radio frequency catheter, whereby we can heat the vein from the inside. You go inside the vein and you heat the vein and you pull back and the vein will seal or collapse down as you pull back.
So you're collapsing the vein.
You're collapsing the vein from the inside as you do. So you're collapsing the faulty vein so that the blood is diverted from the faulty vein into the good vein.
And so then from now on, that collapsed vein is just not used.
It's gone. It's absolutely gone, and it's useless. Basically, it's useless anyway. It's not. And people say, "Well, don't I need it later on for my bypass, for my heart and things?" No, because it's already faulty. People are not going to use it. And it's only going to get dilated more and more and cause problems. So if that is the vein underneath the surface of the skin, it's causing a problem to the skin later on. You want to get rid of that vein and basically divert the blood into the good vein. Now, this is very schematically said, but there are a lot of veins and there's more than enough to take blood from the foot back up to the heart. Because you say, well, closing veins is not good. Well, actually closing the faulty veins is good for the skin and for your symptoms. And basically the other veins, which are the good veins, which you've checked with ultrasound, is actually excellent for basically taking back the backload of the blood.
And how long does this process take?
Quickest I've done a set of veins is 17 minutes.
Wow.
Okay, so you can do it, but normally 2 legs, normally an hour, and then you're off the table. It depends how many veins you're blocking and basically the extent. Sometimes we pull these faulty veins out. These are the branches. And again, through a 2-3 millimeter incision, and sometimes we put a stitch in for cosmetic purposes. But generally the patient can walk the same day, can actually walk out the hospital. It's done as day case surgery, almost back to normal within the next 3 or 4 days.
Wow.
And their legs will be feeling lighter, less heavy, less crampy. The only things that you can't do after venous surgery immediately is don't fly for 2 weeks. Sunbathing after sclerotherapy for 2 weeks, especially in Asian skin, you get browner skin. The other thing is don't eat any raw seafood, slightly higher risk of infection in the first week, and no massage of the legs, okay? I had a patient go back to JB the first week after his vein surgery, and his legs were bright red when he came back to see me. So when I told him not to, so for 6 weeks. So these are very minor things. These are not great things, right? But traveling is probably the main thing, especially in our kind of international hub.
Alright guys, so that's all the time we have for today. We want to thank Dr. Tang for joining us and teaching us so much.
Thank you very much for having me.
It was really very insightful. Also, this episode is in partnership with Sevier. For more information on chronic venous diseases, please head over to the link down below. That's www.deflon.sg. Links are all down below. We'll see you next one. Bye-bye.
Bye.
Bye-bye. Thank you. Oh my God.
How do I...
Wait.
Are these worrying at all?
So what you have is your normal veins on the surface of your leg. Actually, the best way is to stand up. Why don't you stand up?
Okay, I'll
Actually,
stand up. We're all asking the doctor to check out our legs.
Your legs are fine.
Yes!
Okay, yours?
Yeah.
You don't have any vein problems at all, do you? Stand up. Stand
You
up.
gotta stand, you gotta
No,
stand.
no,
But I
therefore
see,
vein.
I see a vein there.
There. That can be part of normal. That's kind of non-normality.
Like-
That's a thread vein. So that can be just part of normality.
So you're into legs.
Thank you,
This is a
doctor.
very interesting career path that you can try and explore.
My wife keeps telling me, stop looking at people's legs. But it's just like what you do day in, day out. And